For the active mobility test, we can first ask the patient to flex forward as if they're flexing over a bar to make sure they round their thoracic spine. This is the Adams test when we observe for a rib hump on either side, which points to a scoliosis if present. Then we can ask the patient to place their hands on their hips and extend backwards to judge not only how far they can go, but if they have any hinge points in the thoracic spine. Then we can ask the patient to partially sit on the lab table, interlace their hands behind their neck, and then side bend to each direction as far as they can go. We can assess quality and quantity of motion. Does it hurt? How far can they go? And also, do they have any hinge points in the thoracic spine? Then we can ask them to cross their arms across their chest and also rotate as far as they can to each direction. Again, assessing for amount of motion. Does it cause their symptoms? And also, do they have any hinge points in the spine? For the passive mobility assessment, we ask the patient to sit and form a neck collar. We move the patient using their elbows. We can first assess the Ct Junction. When I flex the patient, you can observe for changes in space between the two spinous processes. Then we can migrate down and feel the movement of the rest of the thoracic spine as we fully flex the patient. When we flex the patient, we expect the spinous processes to move farther apart, and as we extend the patient, we expect the spinous processes to move closer together. You may be able to pick up hyper or hypomobility doing this. To assess side bending, you'll put one hand underneath the ipsilateral humerus, and you'll put your other hand on top of the other humerus in order to side bend the patient away from you. Still assessing for changes in the space between the spinous processes and general movement of the vertebrae also. When we get down to the lower thoracic spine, this maneuver doesn't work as well. It works well in the upper thoracic segments, but to palpate the lower thoracic spine, you can use your shoulder, wrap your hands around the patient, and use your shoulder to push the patient away from you as you palpate the lower segments.